Welcome to Mimansa Longevity. I'm Dr. Mima Geere, physician, functional medicine practitioner, and genomics expert. In today's episode, we're going to unpack a modern healthcare crisis that's been quietly shaping our disease risk, affecting our fertility, accelerating our aging process, and disturbing our mental health. And those are environmental toxins. We'll explore what they are, how they manifest, and what your genes have to say about detoxifying, and the steps that you can take today to reduce your toxic load and reclaim your vitality. So, what are toxins? Toxins are substances that disrupt the biological systems. They come from many different sources: the food we eat, the water we drink, and the air we breathe, as well as mold, viruses, and bacteria. These are all organic toxins. Things like household cleaners, plastics, perfumes, makeup, these are all synthetic toxins. And internal exposures like alcohol, medications, and even emotional stress are toxins for the body. Some toxins cause obvious reactions, while others build up slowly, altering our body over years. And they're linked to many things like hormonal disruption, cancer, neurological conditions, infertility, autoimmune disorders, and many more. So, what is toxic buildup and what is the body burden? Your body burden is a total amount of toxins accumulated in your tissues. And when the rate of exposure exceeds the body's detoxification capacity, toxins start to build up. The body burden actually grows through the daily use of conventional beauty products, non organic foods and pesticides, environmental pollution, synthetic clothing and cookware and packaging, and frequent flying, like having long commutes on the highway, and also poor indoor air quality. So, most people don't feel this burden until symptoms appear like fatigue, bloating, skin issues, hormonal imbalances, mood swings, and immune dysregulation. So, let's discuss organic versus synthetic toxins. Now, organic toxins are still toxins, they just come from natural sources. That doesn't make them better. For example, mycotoxins that are coming from mold, or endotoxins from bacteria, or biotoxins that are come from parasites or viruses. These can persist in the body even after the organism is gone. For example, you can clear the mold, but mold toxins linger inside the fat and in the neurological tissues. Synthetic toxins, on the other hand, are human made. So things like phthalate, BPA, parabens, glyphosates that we all know about now, and pesticides, as well as flame retardants and plasticizers. Solvents like xylene, toluene, and benzene, and microplastics and industrial chemicals. These all disrupt the endocrine function, affect your mitochondrial energy and your immune resilience, especially when they compound over time. So let's talk about detoxification genes and start to understand what makes your body unique. Your genes tell us all about your detoxification capacity. Some of the most important SNPs or SNPs are involved in detox. And those include the GSTT1 or GSTM1 genes that code for glutathione transferase. These are enzymes that clear toxins from the liver. Some people have deletions in these genes, meaning that they don't produce these detox enzymes at all. Other genes like COMT are known to break down estrogens and catecholamine, the stress hormone. Slower variants of these can lead to anxiety and estrogen dominance. And then the MTHFR gene, which is involved in methylation, helps detoxify heavy metals and supports normal DNA repair. Liver enzymes are responsible for drug and toxin metabolism. Functioning improperly can affect the ability to metabolize pharmaceuticals. NQO1, SOD2, and GPX1 are oxidative stress protectors. These mutations can lead to faster cellular damage from toxins. So, knowing your detox SNPs helps create a precise roadmap and tells us where the support is needed the most. Glutathione, methylation, antioxidants, phase 1 and 2 liver detox. We get to decide, and it's precise. You can also test directly for the toxins and your capacity by looking at your body's specimens. So we can test your blood and we can test your urine to assess the toxic exposure and the detoxification capacity using lab tests. Now, this isn't just looking at genomics anymore. We're looking at heavy metal screening, mycotoxin panels, oxidative stress markers. We look at genomic methylation pathways, liver, kidney, and inflammation panels, and functional tests to detect the mold, the pesticides, the solvents, the plastics, and other environmental exposures that are measured in the blood, urine, and stool. So let's go through and create a full list of this type of testing. You can find this in our newsletter on Substack. It is for those who have actually subscribed. So be sure to go ahead and subscribe to this channel, subscribe to our Substack, and you can learn more. You can detoxify through multiple pathways in the body: the liver, the spleen, and the kidney via urine, the stool, the sweat, and also through your breath. Functional medicine detox supports all these routes, as well as using certain key nutrients like NAC, glutathione, calcium D-glutarate, DIM and broccoli sprouts, and also nerve 2 activators that are found in many different foods like omega-3 rich foods, turmeric foods, and sulforaphanes. Certain herbs like cilantro, parsley, and chlorella, as well as milk thistle, are known to help detoxify, as well as sweating, like in the sauna, and having hot baths and movement. Your breath work and fasting can help boost your mitochondrial cleanup and autophagy. And then there's an Ayurvedic and plant-based approach to detoxification, and this is what we also offer at the clinic. Ama, which is a buildup of these toxins, can actually be alleviated by certain Ayurvedic herbs. Again, this will be published in our post on Substack, so be sure to subscribe and sign up for the newsletter. There are also plant medicines and purgatives that are used in shamanic cultures, like those in South America, to help cleanse trauma, purge toxins, and initiate energetic resets. These are powerful tools and should be used safely with supervision in the right environment. So environmental toxins are inevitable, but their impact is not. By understanding your exposure, supporting your detoxification pathways, and working with your genetic blueprint, you can protect your longevity from the inside out. So if you'd like to explore this further, I invite you to sign up for Mimansa Longevity. This is an online clinical community and practice. And for those of you who would like to get to know us better, I invite you to also join our cleanse program, Kosha, which is available through the clinic. Until I see you next time, I'm Dr. Mima Geere for Mimansa Longevity. Stay well and stay healthy.